There's been numerous advancements in technology over the last several years in orthopedics. It's a constantly evolving field. Luckily, with this advancement in technology, it typically is associated with improved patient outcomes. One of the newer technological advancements is the bare implant or bridge enhanced ACL repair system. This allows us to repair ACLs as opposed to reconstructing ACLs, which has typically been the gold standard in the past. By doing this, we use the patient's own tissue as well as a graft to augment an ACL repair and optimize healing so that we can potentially shorten their recovery process and get them back to the activities they want to get back to more quickly. So this procedure is very new and it's state of the art, and it really has changed the way a lot of ACL injuries have been managed over the last 1 to 2 years. It just comes down to a discussion with the patient to make sure they understand what the potential benefits are of this procedure and how this could lessen their recovery time. I have patients that come in asking for this implant because they've done their own research and they're very excited that it's something that we do and it's something that can get them back to things more quickly with less invasive measures.